have almost everyone here from the Family Services team. And I just wanted to start off by saying thank you for inviting us to join your call today. We're excited to share some information with you about our team, our resources and tools and initiatives, and the different focus areas within that. So I will kick off the presentation, and then we'll be hearing from representatives from each of our departments to speak to you a little bit more about what we all do. And as Gabby said, we will have some time for questions at the end of the presentation. All right, so to kick it off, I will start here with our family services team. So as you know, Autism Speaks is built upon 4 pillars: science, advocacy, awareness, and family services. So today we will be focusing on our family services team and also the advocacy within the family services pillar. So Family Services is committed to connecting and empowering individuals with autism and their families with resources to improve their quality of life today. So Family Services focus on 3 key areas, including resources such as our over 40 toolkits, our resource guide, which serves as a national database of resources where families can go search by their state, narrow by zip code, and access a number of different services ranging from advocacy to healthcare to education. We also have an autism response team, which you'll be hearing more in detail about, but they're trained to field questions and respond to calls and emails from individuals with autism and families, and provide a real critical link to information and local resources. We also have an outreach team, which I am a part of, and I have some counterparts here representing different regions across the country, and we work to share outreach and disseminate information to the community, including our toolkits and priority initiatives too. And lastly, our focus area on grants. So this includes Autism Speaks Cares, a number of different scholarship programs, including swim and water safety, as well as a Baker Summer Camp program, and local grants, to name a few. So our family services resources range across the lifespan and the full spectrum, and all of our family services resources are free and can be found online at this link that you see here on the slide. And again, you'll find those toolkits, you'll find guides, helpful forums, tips and tools from experts, current news and information, and more about our grant programs. So while the focus is the entire lifespan, there is a growing emphasis too on transition and adult life, so including employment, housing and residential supports, and also community engagement. So our community outreach team is dedicated to sharing the mission and priorities of Autism Speaks with local communities, including individuals with autism, their families, educators, professionals, and more. And we do this through a number of different ways, and I'm sharing some information here from our webpage. So if you'd like to find out more about the community outreach team, finding out about upcoming events in your area, including town halls or safety events. If you're interested in volunteering to participate in any review of grants, finding local resources, and also for groups who are interested in requesting a presentation to their school or within their office, that's where you can find out some more information here. So again, as I had mentioned a little bit earlier, the community outreach team has a manager in each of our 4 regions. So you'll see us listed here. We've got Marianne Sullivan out in the west, myself here in the northeast, Megan Pauley, who is our community outreach manager in the southeast, and Colleen Shin out in the Midwest. So highlighting some of our priorities over last year, giving you a year in review, so to speak. So the next couple of slides, we'll talk to our family services priorities, which include, again, resources across the lifespan, and our Autism Speaks Adult Services Town Halls are one piece of that, and they are a national series of town hall events that bring together communities to hear from a panel of experts, to engage with local resource providers, and also really to offer an opportunity to connect with one another. So those have been held in each of the 4 regions across the country. Also really focusing on safety across the lifespan. So we've been sharing resources and making connections to information through a number of different avenues. One being first responder trainings, where we bring together local law enforcement, fire departments, EMS, to learn more about autism and really kind of promote a better understanding of what it means to be on the autism spectrum, as well as to provide tips and tools for use in the field to really promote effective and efficient safety response. We also host, in partnership with our first responders and also communities at the local level, safety fairs, which give an opportunity for families to come out and get to know their local first responders, and similarly add a practical application for first responders and developing those connections with individuals within their community who have autism too. These also contain a resource fair, and they comprised of local safety resources, including swimming programs nearby. Okay, so here's a quick look at some of the numbers of these events. So we've trained over 10,000 first responders. Our safety fairs have reached more than 6,000 participants. We've also held, in partnership with JetBlue, a number of Blue Horizons events, which invite families to come out to nearby airports to go through the whole process of boarding a plane. So getting through security and eventually boarding a plane and taxiing on the airport. And there's a training element of that too for staff and volunteers. And again, our town halls have reached more than 2,500 participants. So just looking again at some impact here, nearly $7.5 million have gone to local providers through our family services grants. You'll see the impact too highlighted of the Autism Cares grants since 2010, and also the iPad grants, which are an annual program to connect individuals with autism with assistive communicative technology. All right, so with that, I'm going to turn it over to our adult services team. We've got Leslie Long and Dave Kieran on the call with us too. So thanks, guys.
Absolutely. Can you guys hear me?
Yes.
Yep, we can hear you.
Oh, good. Okay. I'm going to start and then hand it over to Dave. Thank you for this invitation. I think it's just coming off of the all-staff call that, you know, we are working cross-mission, cross-purposes, which obviously is extremely helpful for families that are impacted and individuals that are impacted. I just wanted to explain that adult services has always been in the thought of Autism Speaks, but was officially started as a program. I guess it's been almost 5 years. There was a recognition that when you transition into adulthood, there really isn't any system that overarches or overreaches to help you find those supports, whether it's vocational or housing. So there was a real gap nationally on trying to help adults and their families figure out what to do next, where to look for a job, where to maybe go to college, where to live, where to recreate. And that's really how our adult services got started. It was really in response to a lack of some national resource. So with that, Dave's going to explain to you all the different adult resources that we offer.
Great, thanks, Leslie. And some of this information, I think most of you folks on the call will know, so we'll go quickly through some of this kind of setup. But as we all know, autism is a lifelong disorder. There are currently more than 2.5 million adults with autism living in the United States amongst us. They're working with us. They're in our communities already. But we do know that those numbers are going to increase with the rising prevalence rates or estimates from the CDC using 8-year-old cohorts. So our best estimate is about 50,000 teens with autism are exiting high school and entering adulthood every year. So it's about 500,000 of these young adults with autism entering the workforce, entering the housing market, needing services to live as independently and as safely as possible over the next decade. And as Leslie mentioned, the adult services system right now is very disjointed. Services are hard to find, and the few that are very good can be very, very expensive. And the waiting lists to access services and access funding from each state can be decades long. So some of the things we're working on, Family Services has long been in the business of creating guides and toolkits. We've done the same for young adults and the adult population as well. So here are a few to kind of reference when you have some time to take a look at our website. We have others as well, but these are kind of the key ones that we refer people to quite a bit. The Transition Toolkit is very effective and very important. We want our families to start planning the transition to adulthood as early as age 13, 14. And this Transition Toolkit will walk them through the steps, some of the different options to consider, including financial planning. This is also being adapted for each state, because each state has different systems in place, different names of government branches, et cetera, different contact names. So we have developed kind of a step-by-step guide for each state with the correct websites and contact persons that they should reach out to. We also have a post-secondary education opportunities guide that goes along with the Brian and Patricia Kelly Post-Secondary Education Scholarship Fund. Now, the opportunities guide focuses on the different options that are available to adults with autism and other disabilities. So the range goes from traditional four-year universities to also include community colleges and vocational schools, technical trade schools, and then also life skills programs for those who may need that instead. We do want to make sure that our community is aware of the different options that are available based on the needs of their young adults. And then the community-based skills assessment is something that we're really proud of. It was developed by a team at Virginia Commonwealth University, and we think that this is a really highly effective assessment for understanding the capabilities of young adults and teens with autism in the community, actually performing the tasks that they'll need to in order to live independently. So it's not a paper and pencil assessment that's done over the phone like others, like the Vineland, for example, which is very highly regarded. But this actually takes a look at what the person is capable of doing, what they actually do in the community. And we think it's very, very important that our families and our school districts start to use this assessment or others like it that are more skills and community-based assessments. So this is available for free on our website, and the team at Virginia Commonwealth is actually now pursuing funding for validity and reliability studies that we think will help us make that case for using it. And then focusing on the adult population, we have 4 different employment guides or toolkits. The first one was written for adults with autism, and it's a very long, in-depth toolkit. It ranges, tries to serve the entire population across the autism spectrum, which can be difficult. But there's tips for, how to prepare and dress for an interview, how to best present yourself in an interview, and making eye contact, etc. Having your talking points, ready. The different types of positions, the different types of supports you may need and may seek out, and from where. Then we also have developed guides for employers and for parents as well. And then Leslie has written a Autism in Big Business report, kind of showcasing the big corporations that have made the effort to include people with disabilities as part of their diversity and inclusion programs. We also have a housing and community living toolkit. Again, it gives an illustration of the range of options out there for people with autism, which will include group homes, foster care living, and everything in between. And then the last one is the most recent. It's for adults who are diagnosed in adulthood. Many of them are parents whose children have been diagnosed, and then they subsequently get a diagnosis of their own autism, and they'd like to know what does that mean for them and what should come next. So we've written a toolkit called Is It Autism? And if so, what next? We have a number of different employment initiatives ongoing. One of them is focused on small businesses, and there's a very exciting one, two pilot projects happening now that will wrap up in the next month or so. One is down in South Florida, the other is in Chicago. It's really a Midwest initiative. And it began a couple of years ago with Leslie and I hosting an employment think tank, and it's grown from there, where we have identified about 15 different small business models that have shown themselves to be successful and replicable, hopefully, and sustainable. And we took those 15 businesses on the road. We held town halls across the country, introducing them to the communities, and it had such a great success. But what we did find out was parents had some great ideas about building businesses around the interests and skills of their children with autism, but did not have the business experience. So there's also small businesses out there who are in the community already, successful and sustainable, and now want to start thinking about how to hire people with autism. So they're missing the autism experience in education. So these two pilot programs were designed to become hubs of information so that people can go to them with questions and help them build their own small businesses around people with autism. And they're very successful. We're very pleased with how it's going, and we recently received funding to start 3 more of these in 2016. At the same time, there's a parallel focus on corporations. So we are working with a number of different organizations together to advance people with autism as well as other disabilities in the corporate world. So the Pepsi Act is a good example. Autism is only one part of the Pepsi Act. Autism, as well as returning veterans and people with traumatic brain injuries. So we're partnering. We're one of several funders in projects like these. Advice is an autism-specific program that is a consultancy, like a full-scale consultancy, to come into a large corporation and help them set up an autism-specific hiring initiative. And the bottom one there is the Spectrum Careers is our new jobs portal. And the exciting bit of news we have on this is we've, just in the last day or so, passed over the 14,000 job mark. So we have 14,000 job opportunities from businesses across the country posted in the Spectrum Careers, and they're offered by businesses who are interested in exploring how they can better employ and support people with autism. Now we have about 1,200 individuals with autism also registered on the site, and they're the job seekers. So they post their resumes. We help them create their resumes if they don't have one, and we have special tools that allow them and the businesses to create visual representations of their skills and experiences, and also for the businesses that they can create a visual representation of their job description. And then there's a third user to that site, and that is service providers. So Autism Speaks does not have the bandwidth to be the connector on each of these individuals as they look for a job and hopefully sustain employment. So what we've done is we've invited the service provider community to register at the site as well, and they help make those connections possible. So we should just point out the site is free for all users. It was designed by a young man with autism, and it was designed to work very similarly to Monster.com or Hot Jobs or other job sites that we all know. Now, housing and community living, I know I'm running out of time, Janice, I'm going to go really quickly, but we have 2 really exciting initiatives, I think. The first one here on the left is our House to Home Prize. What we've known for a long time is the options for people with autism to live as independently as possible, as safely as possible in the community have been kind of stale. There's been only a certain number of models that have been shown to be very, very effective and replicable at a cost-effective rate across the country and in different rural, suburban, and urban communities. It's been difficult, and so what we've done is we've reached out beyond the typical autism circle. We've developed this challenge to reach out to architects and city planners and just innovative thinkers. And there's a prize at the end of this. So what we're asking for is ideas for how to better support greater numbers of people with autism at a more cost-effective manner. And we have $150,000 to give away. So we're giving away 3 prizes of $50,000 each, and we've gotten over 400 innovators from across the world, all throughout the world, Africa, Middle East, and everywhere else, who have ideas that they think can help solve this crisis. And that the winners of that will be announced in April. The BUILT course on the right there is about building independent lives through training. And this is a curriculum that was developed by the Autistic Global Initiative, largely made up of professionals with autism. And this is a curriculum for direct support providers who serve adults with autism in residential settings. So how to best support someone with autism, whether you're in a group home, whether they're in their parents' home but need some outside help, or they're trying to live as independently as they can and just need some outside services. So we think this is a really, and it is really the kind of one of a kind, very in-depth curriculum that we are trying to get into the big service providers who are serving people with autism today, who maybe not giving their workforce so much autism-specific training. Yeah, you see LinkedIn at the bottom here. We do have LinkedIn groups that are focused entirely on the housing and community living issue, and a LinkedIn group is focused on autism employment. And they have a couple of thousand members each, people talking about what's happening across the country, asking questions if they want to start something of their own. And it's been highly effective. So I do have a video, but I'm out of time. So I'm just going to skip the video for now, but it's a very brief video, about 1 minute and 20 seconds, about the House to Home Challenge. So I encourage you to check out the House to Home Challenge on HeroX.com. HeroX is the partner we're using, the platform we're using for the challenge. And that's it.
Thank you so much, Leslie and Dave. That was a wonderful overview of adult services. And now do we have Angela Lello on the call to talk a little bit about advocacy?
Janice, she may not be on the call. We can go ahead.
Okay, so our advocacy team is working together across the lifespan to really help to shape public policy and improve the future for all who are living with autism. So just a quick highlight, but let's continue on to the art team so that we can get to some of the questions and have a little bit more of an interactive discussion toward the end.
And I just want to, this is Angie real quick, I just want to chime in before Emily gets started. I think for Family Navigators especially, we've already had this presentation from the Family Services Department, and we've also given them an ATN presentation. And one thing we really hope to get out of this between the Family Navigators and the art team is to really start to build a collaborative relationship. So for all of you Family Navigators, hopefully you can pay close attention to what Emily's saying and just start having your minds think about ways, as she's presenting different things, how that could work with the work you all are doing as well. So I just want to throw that out there before Emily gets started.
All right. Hi, everyone. Can you all hear me?
Yes. Thank you, Emily.
Great. So my name is Emily Mulligan. I'm the Senior Coordinator for the Autism Response Team. And as we've mentioned a few times already, the Autism Response Team is essentially kind of the connection between families and all of the other great work that we're doing in family services and advocacy and science. So we speak directly with the families to connect them with whatever resources they might need. So we are trained to respond to calls and emails, which provides a link to, as I said, critical information, tools, and resources for all members of the community. So we do speak with lots of parents. We speak with individuals and adults who have autism. We speak with grandparents, teachers. So it kind of spans the entire community. In 2014, we responded to 47,600 unique calls and emails. I believe in 2015 it was over 50,000. So we do get a lot of calls, a lot of emails, a lot of people looking for help with kind of a variety of different things. I would say that the prevalent topic that people need help with is mainly seeking local service providers. So whether that's therapists, whether it's finding a local advocate, whether it's finding a doctor or a specialist, people often have not really a great idea of how to get that process started. So we kind of can serve as a starting place for them. And we do provide a person-centered response to all of these requests. So we really personalize the information that we're giving to them. We connect them with specific resources just to make sure that they are accessing the resources that they need. And really I think the biggest kind of point that I would like to emphasize is that families a lot of times have to navigate so many different systems and so many different resources, and it can be hard to kind of put all those pieces together. And I think AIRP, one of the things that we really try to do is try to connect those pieces for families and allow them to access the different systems and navigate the different resources that are out there. So since 2007, AIRP has responded to 138,000 calls and emails, and I believe that actually would be higher I don't think that includes the 2015 numbers. So again, we do get a lot of calls, a lot of emails, and we do have coordinators in a whole bunch of different areas in the country. So we have some in the Northeast, we have some in the Southeast, we have a Midwest coordinator, we have a coordinator out in California, and that really allows us to each focus on the areas that we're in and really get to know kind of the services and the different systems that are in place in each area, and that allows us to, I think, guide our families even better. So just, I guess, to go over some of the biggest things that we see. Some of the major trends that we see include families who have just gotten their child's diagnosis. So for those families, we connect them with our 100-day kit. We help them access local therapists, help them get started with either early intervention or their school system, kind of just giving them a starting place. There's just so many different resources out there, which is, on one hand, it's a great thing, but it can be so overwhelming for families who may have never even heard of autism before or have no idea what it involves or what they're looking at. So we kind of help them get started, help them kind of set up some supports for themselves. So I think that's definitely one of the major trends that we see is newly diagnosed families. We also do see a lot of families needing help with school issues. So, having issues with the IEP process, maybe they're not accessing the right services. So a lot of families kind of come to us when they don't really know where to go. So we have some toolkits related to school issues. We can help families connect with local advocates and help them understand a little bit more about their rights and their child's rights. And so just kind of, I think that's the biggest thing for those types of questions is helping families understand and giving them the information to go into these meetings and really have a solid understanding of what they can ask for and kind of how to go about that whole process. And then another major trend that we see is families dealing with challenging behaviors, and that can be a really, really tough thing to deal with. It can make a lot of parents do feel isolated because, if they have trouble going out in public or if they just don't know how to help their child. So that's another one we see a lot, and that's somewhere that I think that can be a real collaboration with the ATN. I know a lot of times I've reached out and sought help finding, inpatient care for a family or helping them find a, really good behavior specialist. And that's the kind of thing where, especially in areas where we're not as familiar with the system, with the services, I think having you guys at the ATN as a resource to who you might know more in terms of what's available in a certain area. I think that's really a huge opportunity for collaboration there, and I know that we've already started utilizing that connection for sure. But that's definitely something that I think is really important to help our families. And then I guess Some of the other things we see include families looking for financial help, a lot of safety-related questions, so we connect people with wandering resources and that kind of thing. A lot of insurance questions, so learning how to navigate, how to access autism services through insurance and through Medicaid and Medicaid waivers, and that touches a little bit upon the connection with advocacy. It's another way to, our advocacy team helps us out a lot in terms of that kind of information. But again, just having that connection, having families be able to call us and be like, I don't know where to turn, and then we can then connect them with advocacy or connect them with the ATN or what have you. That's a really, I think, an important function of the autism response team. And then this is, again, I kind of touched on this already, but we do have coordinators in 4 different regions. We also, an important thing that we do have is we have 2 bilingual coordinators who speak Spanish. So we do have a dedicated Spanish line for families who primarily speak Spanish. And again, that we hope that will increase the availability of information for some of these families who might not have had access to resources or information on autism before. And we know that a lot of times those communities their children are diagnosed much later just because they don't always have access to the same types of resources in their native language. And then we do also have an adult services coordinator. Dave obviously went over a lot of the adult services initiatives already, but we do have a coordinator who primarily speaks with the adults who call and connects them with the different resources that are available to them in their area. And that's obviously a huge need, and I think we've seen that grow. We've seen the number of adults contacting us grow. So that's really important that we are continuing to focus on resources for adult population. And then this is just a few of the, I guess, testimonials that we have from families that we've spoken with. And I think that does just further emphasize sometimes just having someone on the other end of the line who, understands what families are going through and maybe can connect them with the right resources. That really it makes a huge difference, just knowing that someone understands. I think sometimes families talk with so many different, they talk with their insurance company, they talk with principals, they talk with school staff, and each of those areas are kind of, they know what their area is, but they couldn't necessarily understand some of the other things that families are going through. So I think having us there to kind of help with whatever a family might need is really helpful, and I think that it is appreciated. And like I said before, a lot of times it's just really hard to know where to start, especially when families first get that diagnosis. And we do have information saved on, I'd say, hundreds of topics, so we can really kind of tap into those resources, so families don't have to go, searching all over the internet and, get lost and overwhelmed. So we do have a lot of information, and like I said before, we can also tap into some of the connections we have with, the ATN, with the advocacy team, just to get families the right contacts and the right information. So I'd say that's about it. I think I probably left something out, but you're welcome to, my contact information is right there, so you're welcome to let me know at any time. But I am really excited. I think that a collaboration with, all of you out in your local communities with your areas of expertise, I think that's really a huge resource for the art team and for our community, and I really do hope that we can continue to collaborate and work together, because I think that I know that families really do appreciate that, and I think it makes for the best outcomes for them. So, all right.
Thank you so much, Emily. That was great. So, Angie or Gabby, do you want to share any additional updates before we move into questions?
No, there are some comments I'll have, but let's open up to questions first, and then I can make some comments.
Sounds great.
Does anybody have any questions for the Family Services Department?
Hello?
Tom.
Kamina.
Hi.
I was just going to call you out, Kamina.
Why? No. But yeah, no, I'm not afraid to speak up and say that I really feel like they're both presentations, and especially that one was really wonderful. But it was really wonderful. My question is just simply how we can improve the collaboration, because I want to know what it is that we can give to you, and I'm an FAC, a representative from the ATN, so I want to know what more that I can do and what we can put in place to make sure that you all have updated information, that there's plenty of information, and that there's resources that parents can have from our side of things to just really help out their situation. I have called the line myself for some things, in addition to like our local 211. And I know, what power you guys hold in that. And so I'd like to lend myself to that, and I want to know how we can do that better.
That's fantastic, Kamina. I'll answer this first, and then if anybody from Family Services wants to hop in, please do so. That's fantastic, Kamina. And I don't think we've updated you guys now that I'm realizing as to giving you more of the details as to what we've been talking about. But we are, as it's been mentioned, that we are trying to really close the gap between Autism Speaks and our ATN sites and the folks that are on the ground doing all of the work at both AS and at the ATN sites, and really pulling together the Family Services Department and the ATN, since there's a lot of overlap and we're all supporting families. And one of the first steps is, we're going to be developing several different ways to collaborate and work closer together. So I love that you threw your hat in. I'm not surprised, because you're always willing to do anything to help, and I love that. So we'll definitely, we have to talk more offline, like maybe we can form a work group or something around this. But one first step is to really pull the Family Navigators and the ART team together, since they are providing resources to the families, hoping we can kind of connect those two. And then it does make complete sense to have the FAC give input on that as well, since you guys are our parent representatives. So when we put those connections together, maybe we can pull some FAC in as well. But I'd love to hear ideas from you all on ways you see that we can collaborate. We really want, what we would love in the ATN, we meaning the Autism Speaks staff of the ATN, is to really have Family Services utilize the ATN as their platform for a lot of their initiatives that they're working on. So, for example, when they develop the wandering program or safety, that in the future, when something like that comes up, that they're turning to the ATN first for assistance, or seeing what's already being done in the local communities, what's the need in the local communities where our ATN centers are, what experts do we have on, what can our family, our FACs, provide input and things like that to really help Family Services launch their initiatives. And then vice versa, ways that we can really utilize the Family Services Department to help us launch our initiatives. So this is brand new. We're open to ideas. So send them my way if you guys have any thoughts, or if you want to participate in something, just feel free to email me. But this will be an ongoing conversation, and we really look forward to this collaboration. So I don't know if anybody from Family Services wants to add to that as well.
Hi, this is Lisa Krasner. I'm here at my site with the team here in Orange County. I have a question for David. David, you've been doing these conferences on the East Coast. When are you going to come to the West? This is for the adult businesses or whatever,
So actually, we have, as I mentioned, we have funding now for 3 additional sites in 2016, and 2 of them will be in the West. So we're looking at, we have not come to a conclusion yet on specifically where they'll be, but I can tell you a very high chance that at least one will be in California, and we're looking at some other Western states as well, and there'll be one in the Northeast, probably New England area. So we are very mindful of that. We want to make sure we're covering the entire country as quickly as we can.
Okay, thank you, David.
Yeah, no, Liza, thanks for the question. But I do want to point out that we a part of our vision for this is not to remain local with those resources. So as an outcome of these first 2 pilot projects, there is already a new Facebook group that's been started kind of organically by some of the participants. And there's a couple hundred people now part of it, and it's I can send it to you offline. I can't remember the name of it off the top of my head, but it's like Autism Employment Group or something like that. And it's a place to go for questions and answers. Leslie, you have something to add?
Well, I just want to mention that, when the project started, we had a lot of small business meetings in the West. This particular round, we have Florida and Chicago, but I don't know if you guys were familiar with all the small business meetings we had in LA and Arizona, not last year, but the year before.
No, right, not quite aware of it, and that's probably why if I just have not been in the loop. It would be nice, though, to be in that loop, so that's why I asked.
Absolutely. Okay. It brings up another point. I really liked what you said, sorry, Angie, but I just want to add one other idea is, we have had these town hall meetings across the country, and we don't currently have a budget for new ones, but it doesn't mean that we can't do them. They're actually very, very cost effective. They're low cost, and using the ATNs as kind of a starting point where we know that there are experts, we know there are families and other resources, including a space for such a meeting. It would be great to hear from you guys on what topics are of most interest to your families and to children and young adults with autism. Ours have mostly focused on employment, housing, and on safety. But we'll be starting up, we do have some funding for a new round this year that we focused on financial planning, and really we could do these town halls on a number of different topics. So they've been pretty effective in engaging the community. They do like kind of the face-to-face time with local experts, and they're pretty easy to do. We'd be happy to kind of support from here, and our outreach team is always a part of that process too. So it could be another way that we can work together.
I think that's great, Dave. I think that's a really great idea, and I would love to explore that more to see how we could do that and, what sites would be interested in participating in that. So I think that's a great idea.
Angie, I just want to butt in and say that based on that last comment that I think that brings up a really important point, knowing what all is going on and as far as community events or, even national events. I think if we could be made more aware of what those opportunities are, we'd be able to do more about it. And so I just want everybody to put me on the list to let me know what's going on, and then I will pop up. Thank you.
Absolutely. Janice might be able to tell us more about how that community outreach team, I think, is really the group that can be that conduit into the information that you need. Janice, is there like an easy way that we can make sure everyone's up to date on what's coming?
Yes. So one of the ways in which folks could do that is first starting with our soon-to-be updated and ongoing, it will be updated on an ongoing basis, is the Community Outreach Team webpage on Autism Speaks website that I had featured in a few slides earlier, but that will include information about those adult services town hall events, also the safety events that I had mentioned, and two, the smaller kind of community-based events. So that is some place where we have, on an ongoing basis, added info about where the event's being held, what the focus area will be, how to register. But beyond that too, we do a lot of outreach to our local communities, whether that's through social media or through e-blasts. So Angie, maybe we can talk about too getting a contact list for everyone who is part of the Family Navigator Committee and also the Family Advisory Committee too, so that way we can just, and also of course the ATN coordinators, but just making sure that we have access to that and can push info out through those channels as well.
Yeah, I agree. And just so everybody knows, this is something Janice and I are working on offline is a plan that we're putting in place and how we can continue this relationship and build upon it. And I think that is one of the things that's a good point that we have to really make sure we're including is how to share the information so folks are informed. That's really important. So, great. Does anybody have any other questions or comments for the Family Services team?
This is Kathy Smith from CHLA. I don't have a question, but I have a comment, and
Sure.
that is that the online resource guide is so awesome, and we use it every day, all day. Not just in our autism and developmental behavioral pediatrics program. We use it in our mental health program. We use it lots of different places. It's so helpful, and it's so much easier than trying to maintain your own resource directory, which is incredibly labor intensive. So bravo to you for putting together that resource guide.
Thanks, Kathy. I will say that a project that's been kind of long in the works that I think is finally going to happen this year, that system will be updated and kind of optimized, I guess, for mobile devices. So it'll be much easier to use that database from your smartphone and some other upgrades as well. But it is very important. It is very labor intensive too. So part of the upgrade will hopefully ease some of that for us. But thanks for your comments.
Hi, this is Maureen at Camden Irvine, and I was also going to comment that I go to that resource guide pretty frequently, but if I could just make a suggestion, my assumption, and I could be wrong, is that it's kind of if agencies want to be in it, then they are asking to be in it model, but I'm wondering if you guys are going to be sort of revamping it, ways that we could actually get more agencies involved in being in the listing. So I had a call from Modesto, California yesterday, which is south of Sacramento and east of San Francisco. And then I had a call from El Centro yesterday, which is on the east of San Diego on the Mexico border. And unfortunately, when I put the zip codes and even a search of, I think, 50 or 75 miles for both of those, nothing popped up, but I knew that agencies do serve that area. For example, in California, we have the regional center system and other agencies. So I'm wondering if when you guys are working on this going forward, if there might be a way that we can suggest some agencies for you guys to upload into the system and not just rely on agencies voluntarily putting their information on there. So just a thought.
Yeah, I think it's a great suggestion. It's an idea we've had, and it is a challenge that it's a user-populated system. So it does rely. We're kind of passive, and we rely on families often, but then organizations themselves to ask to be added. So there is a way, if you have resources that you know of that are reputable and you think belong in there for families to be able to find. I don't know if anyone else on the call from Family Services, Emily, maybe there's an inbox that you can send it to. It's to submit a new resource to the resource guide.
Yeah, you can actually just send it right to familyservices@autismspeaks.org. I know Allie Waters is responsible for that, but she's out on maternity leave. So if you email it to Family Services, and I believe the address is right up there, so familyservices@autismspeaks.org, we can definitely take care of that. And we love when people do that. Even if you're not with an organization, if you know of a really good one, you're always welcome to send those over.
Yeah, and I think just to add to this, I think it would be great if we could do something a little more formal. So I don't know if Denise is on the phone, but she's one of the ART team representatives, and we were just on email today. You know, there was a situation, an emergency situation this happens a lot, that the ART team will email Gabby or I for assistance. If they don't have resources to help a family, they'll reach out to us, and then we'll reach out to folks in the ATN, or vice versa. If we get an email through our ATN, a lot of times we reach out to the ART team for them to address it with the families. But a situation came up where there was emergency services needed and all this stuff, and so Denise had some resources but reached out, and our CHOP folks were able to provide additional resources, which was really helpful. And she even mentioned it would be great to have more of this around the country. So I'd love to do something a little more formal, maybe surveying the FAC and Family Navigators, and to find out specifically additional resources that are out there that we don't already have in the Autism Speaks resource library. So that would be really great.
I think it's a great idea. There's no reason why we should be missing, for example, regional centers that serve certain parts of California. You know, but we need help with identifying what we're missing. So you guys would be a great resource for us to make sure we're covering that.
Exactly. Great. So anything else? Did you, Family Services team, do you have any questions for the folks on the phone about anything? Okay. And does anybody have any additional questions for Family Services? I know they can hop off in a few minutes, and then if we can just have a couple of minutes to wrap up, that would be great. But if nobody has any more questions, we'll let everyone from Family Services go. And thank you so much, guys, for doing this and giving this wonderful presentation. And we really appreciate it, and we look forward to working closely with you all in the future. So thank you again.
Thank you so much, Angie. Thank you, Gabby. Thank you all on the call. Thanks to the Family Services team, too, for joining me and the presentation.
Great.
Thanks, everybody.
Take care. And then those that are still on the phone from the ATN sites. So if we could just do a quick roll call, and I don't know if everybody's muted. If you, for some reason, can't speak up and you want to just send it in IM, that would be great. But I know I heard Liz from Irvine. Who else from Irvine is on the call?
Peter Tack.
Maureen, Dylan, and Jennifer Fan.
Wonderful.
And Lisa. We're all here.
Great. And then CHLA, I heard Kathy and Committe. Is anybody else on the call from CHLA? Okay. And then, Grace is on. Great. That's okay, Grace. Thanks. And then I heard Tom from Nationwide. Anybody else on? Oops, what was that? Anybody else from Nationwide? Okay, and then how about Arkansas? Is anybody on from Arkansas? No one from Arkansas. Anybody on from CHOP?
You said CHOP? Hi, Amy Kelly's here.
Hi, Amy.
Jean Ann Reynolds from CHOP.
Amy and Jean. Okay, if those of you that are not speaking, if you could mute, and then when I call on your site, you can unmute. There's a lot of echo, sorry. Okay, so Amy and Jean. Great. Anybody from Pittsburgh?
Hi, this is Charmaine from Pittsburgh.
Hi. Thanks. And Laurie Center? Anybody from Laurie Center?
Hi, Suzanne from Laurie Center.
Great. Hi, how are you? And then Vanderbilt.
Yes, this is Nina, and I'm on the call.
Nina. And then how about Toronto?
Yeah, this is Kathy from Toronto.
Great.
And Selena.
And then I have from Alberta, I see that we have Scott and Charlene. Anybody else on from Alberta?
Lauren McGinnis from, oh, sorry. There's two of us. Lauren McGinnis from Edmonton.
Great. And who else?
And Jenna from the Glen Rose, Edmonton.
And Yolande from the Glen Rose.
Wonderful. And then anybody from St. Louis?
Ann Fury from St. Louis.
Great. Anyone from the Thompson Center? And how about Rochester? And then last but not least, anybody from Cincinnati?
Janet Side is here.
Hi, Janet. Great. And so, okay, well, so just real quick to wrap this up, and I don't know if Gabby or Nina, if you guys want to say anything, because this is your committee. I feel like I overtook it today, but thank you so much for attending this really important webinar that we really want to build out on the Family Services ATN collaboration. And as you guys could see, there's so much that we can work closely together rather than each party reinventing the wheels, and putting our resources together to really support the autism community. So you'll be hearing more about this from us moving forward. Since a lot of folks were not able to attend because there also was a QI webinar at the same time, we did record this webinar, and hopefully we can get this recording out so that other folks can view this, or we can play it at like the FAC committee meeting and the coordinator committee meeting so that other folks can hear these as well. But if you have any ideas or suggestions, please email me, but we'll keep this conversation going with everybody, with the FAC coordinators and family navigators, and hopefully we can really build upon this and really help, increase support to the autism community. So thank you everyone for this, and I really appreciate it. And Gab, do you have anything?
Yeah, I do. I just wanted to give you all a reminder that on February 18th is the next Family Advisory Committee meeting, and that's at 2 p.m. Eastern Time, 11 a.m. Pacific Time. You should already have that on your schedule, and it's also on the calendar. And another reminder is that on February 22nd, the Advances in Autism Research and Care webinar that the AIRP presents will be on the Family Navigators study that was conducted last fall. So please register and attend and participate on that webinar so that you can find out a lot of what was in that study and what the next steps will be for the Family Navigation study work group. Excuse me, Gabby, what was that date again? For which appointment? For the webinar. That's on February 22nd. It's on the calendar. If you go to the asatn.org, it's on the calendar. I tried sharing my screen, but it's not working for me. Sorry, guys.
Great. And then does Nina, do you have anything to say as the chair, or should we just end the call?
No, thanks to everybody for joining. I think it was an awesome presentation. I look forward to figuring out from my side and my end how I can be of more assistance and collaborate more with the Family Services team, and I'm sure everybody feels the same.
Great.
So thank you.
Wonderful. Thank you so much, everyone. I hope you all have a great day. Take care.
Thank you.
Bye-bye.
Thank you.